You're listening to the Genomics Minute, brought to you by Genome British Columbia.
What is missing in a healthcare system where genomics education is not considered or implemented, and how does that impact patients?
So the impact, I think, on patients is huge because healthcare professionals need to know about genomics if they're going to deliver the best service for patients. Our healthcare professionals need to know which tests to order. They need to know that they need that training and education in order to ensure that they can choose the correct tests and choose the right options for the patients. They need to understand the genomic test results that they receive so that they can look at the impact on the patient and what management needs to be implemented for that patient's care, and that they can choose the right treatments as well for those patients. So in a healthcare service where there is no genomic education, I think it will be really detrimental to the patient experience.
How is Genomics Education England and your programme ensuring the uptake of the courses? And how are they used? What strategies are they using to educate healthcare providers in the use of genomic tools?
So we have a very active website in which in which all of our courses are accessible, and so we have a comms strategy around ensuring that people are aware that we exist, aware of the courses that we have, and we utilise our networks to disseminate that information as well, and that's really critically important. So, for example, when we had our training and education leads based in our genomic medicine services centres, they were instrumental in informing people that these courses were available, that they were encouraging people to participate in those courses as well.
What strategies is Health Education England using to educate the healthcare professionals on the use of genomic tools?
So what our approach has been is to sort of stratify the workforce into the different layers of the highly specialised workforce, the specialised workforce, the general workforce and the wider workforce, so we can actually think about what's required at each of those different levels. And what we started off by doing is a gap analysis, because we don't actually want to repeat and to duplicate anything that has already been put in place already. It's not like we're starting from scratch. So our strategy has been to think about the gaps, to think about where the need is greatest, and that can include from the highly specialised workforce to the wider awareness workforce, raising work that we've been doing with the nurses, for example. And I think our approach has always been to be consultative, to actually include the professional bodies and include the actual people on the ground to ask them what they want. We have done a training needs analysis as well. And so by doing this top-down, bottom-up approach, we hope to somehow encompass all aspects of what's needed.
Is genomics part of the curriculum in nursing, medical, pharmacy, or any of the other fields of study in medicine in the UK?
Yes, so we now have genomics mentioned in the nursing curricula and the nursing associate curricula. Genomics, we need to look at the genomics content in some of the medical curricula. That's an area of work that we're going to be looking at in more detail soon. In terms of the healthcare science curricula, we know it's embedded across the whole of our healthcare science curricula, and we have a suite of genomic science curricula as well that are master's level and doctoral level. Our next station stop are the pharmacists, actually, to look at what their knowledge is. I suspect there is genomics already in their curriculum, but I don't know to what extent it's in there.